stroke neurological management pathways. We discussed the advanced therapies, but now we are going to discuss the basic imaging. If we are going to talk about stroke, then we will have to act fast. Fast can be managed by its facial dropping, its arm weakness, its speech difficulties, time to get help and go to the hospital. Please keep in mind that ischemic stroke is much more common than the hemorrhagic stroke. It accounts for more than 80% of the cases. We at Siemens have a full portfolio that covers all solutions from the onset of a stroke up to the post-treatment imaging, including the CT and MRI, which we will go through during this presentation. Let's go through the CT firstly. My exam companion has allowed us to take the hands of the technician step by step, guided by AI, and tailor an exam specifically for each patient. If he's young, if he has any concerns about his health condition, if he has any metal, it will be tailored specifically for this patient. A non-contrast CT is our first step. Thanks to our excellent detector, we have an excellent gray-white matter differentiation, as you can see in this image, that allows us to follow up of the stroke easily, as you can see in this case. Also, we have the auto align, which will correct the head position if the patient has a disturbed conscious level and the head is rotated. No more helping the patient to be comfortable without moving his head a lot. The technique of alpha technology will correct the position at the same time of imaging. We can have the solution of the hemorrhage detection. It will detect the hemorrhage, raising the flag that there is an area of hemorrhage here in a non-contrast image. And it will also account for presenting any movement or any shifting of the midline of the brain. Also, aspect scoring. It's important to detect any abnormalities within the vascular territories of the brain, giving you a score, as you can see at the right and left of the cases. Comparing the right and left side of the brain, and if there is any abnormality, it will raise a flag with bold numbers that this area is abnormal one, increasing the susceptibility of an early ischemic changes. Contrast-enhanced CT imaging. Neuroperfusion is our first step in contrast enhancing in order to detect any CBF, CB volume, and the penumbra to help the patient to improve his life expectancy. And then comes the role of high power, 70 and 80 kVs. Now we can image the cases with an excellent gray-white matter differentiation and better contrast enhancement. If we are going to talk about CT angio, we have to go through our photon counting CT. As you can see in these images, it's a unique images with a delineation of the very minimal vessels of the arteries. Also evaluation of the stents. And the aneurysms, even if it's less than 3 millimeters in diameter. 4D spiral has extended beyond the diameter of the detector, giving you an excellent 4D image. As you can see in this image, in comparison between the normal CT angio and the abnormal, the different one of the dynamic 4D imaging, there is delineation of the site of the clot. And dual energy, the future of medicine, we can detect the active and inactive hemorrhages. And then comes the role of MRI. Same as CT, AI has guided you through all the steps of imaging. Just the technician will select the position and the organ will be imaged, and accordingly the exam will start. By simple clicks, my exam companion will take you step by step through my exam autopilot or my exam assist or my exam cockpit. My exam autopilot is a fully automated AI-guided solution. Push button, automated scan protocols, inline reconstruction, and results automatically occurs. My exam assist, it helps also in this procedure by AI-guided procedures. It gives a reference of the cuts of the images, and the technician follows it with same solutions like the autopilot. In ideal world, this is an ideal MRI brain image, but what we get is usually motion of the brain or the patient is uncooperative. Accordingly, In an ideal world, too, the cutting of the image should be in line with the orbital line, but we don't get this thanks to the subjectivity of each technician. Accordingly, AI has took the upper hand, and the auto-align will occur, giving you an excellent image, as you can see in the above images, with comparison of the right and left sides of the brain accurately. This will keep that the images are always constant between all the cases, even if it's an initial exam, it's a follow-up, or even a kyphotic patient, the image quality is always constant. If we compare an exam without my exam companion and my exam companion, you will find that a case of my exam companion, the scan time will be only 10 minutes, but without it, it will be 18 minutes. My exam autopilot has guided more than 70% of the cases of MRI exams, and my exam assist are more than 90% of the cases. Turbo suite is much more important in diagnosis of stroke. It will allow us to perform the examination, full examination of the brain in only 5 minutes. And this is a case that was done in Egypt. It took only 4 minutes, thanks to BrainGo. Diffusion resolve, if you can compare it between the normal diffusion, which has an artifact at the below, and our resolve diffusion, we found that there is no artifact anymore. Even the minimal abnormalities can be detected. And SWI for detection of minimal hemorrhages. Angio without contrast, time of flight. MRA and MRV. And of course, perfusion, same as CT, for detection of CPV and CBF, and penumbra to improve the expectancy of the life of the patient. Thank you.